Now, there are literally hundreds of different ways that you can see muscle response testing demonstrated. Some of the ways and things you'll see here are done in applied kinesiology or neuroemotional technique or quantum neurology or CRA or Neuralink or TBM or SRT or Leibowitz technique. So many different ways. Some are primarily structural techniques, some are nutritional techniques, some are emotional techniques. So with you, we're going to do some muscle testing, which we've been doing, but we're going to take it to the next level. We're going to look at something called quantum neurology. So quantum neurology is like neurologic rehabilitation. So it's something born out of the chiropractic profession. And it looks at so many different things: cranial nerve function, myotones, which are nerves that go to muscles in the body, your sensory nervous system, your autonomic system. So we're going to do something simple. We're going to do what's called a myotome analysis, but we're just going to test a couple of muscles, okay? So we're going to test ones that go to your arms and your to your fingers. So let's start with something simple like let's do your deltoid. So I want you to hold this up like this. I'm going to push down. So that's for your C5 nerve, okay? That's intact. Let's do something for C6, which is your bicep. So I'm gonna pull. So in your case, this is kind of wobbly, okay? So not as strong as it should be. Let's compare it to the other side. I'm gonna pull. That's strong as a rock. Let's try this again. I'll just use one finger. See, so it's not working at 100%, so to speak. So what we're gonna do is we're going to turn on that myotome, so to speak, or strengthen that nerve. What we're gonna do is we're gonna use something over here called an arthrostim. This is an arthrostim instrument. The kids call it the tickle gun. We'll take this head off here and watch, hold your hand out. You can set the different ways it fires. It's like a little baby jackhammer. So what we're gonna do is we're gonna stimulate this nerve here, but on you, okay? We're also gonna use these GRT lights. These are developed by Dr. Gonzalez, who created quantum neurology. We're gonna turn these lights on. They're little red flashing lights. They're a combination of infrared and LED lights. So what I'm gonna have you do is you wanna use this muscle, okay? So I'm gonna place this right here and I want you to hold it here for me. So basically this is shining through your brainstem area, so your brain's like, huh, she's got light in here, something's about to happen. And so we're gonna take this light and we're gonna shine it through your C6 nerve or where it exits. We're gonna take this instrument and we'll lightly stimulate it like that. It takes about 10 or 15 seconds and it seems to actually strengthen the nerve and it functions better, which is a good thing. So we're gonna go just like that, super simple, and you could just feel like a weight was lifted, okay? So let's see if we did any more than just jackhammer you. I'll take this, we'll shut these off. Now we're gonna test that same muscle. So we're gonna pull, and now it's strong as a rock. So again, we would expect that to stay strong unless you re-injured it some way. So now we're gonna do some nutritional testing. So there's so many different ways to do this. And again, this is just how cool the human body is.